I want to talk about the fact that for the first time, we have data on the mental health and well-being of people who identify as LGBTI in the Southern and East African region, and that we have data at a comparative level on mental health and well-being, on experiences of violence, and on access to healthcare for LGBTI people. And that this is the first time that we have a data set that we can compare between countries, and that we have a data set that is also large enough that we can look at specific subgroups. So we can look at lesbian participants, we can look at gay participants, we can look at trans women, trans men, and gender-conforming people within the entire region. So we've been working on it for about 3.5 years, and I think there's sort of two very big changes that I can see from the perspective of the person who coordinated the research process. And again, the one is just having evidence available of things that for a long time we knew and that organizations knew. But for the first time, being able to point to numbers to substantiate arguments has been one big change. So one example is that at some point, somebody from the Southern African Litigation Center phoned me and said, would you be able to write us a research brief that shows the impact of the law that criminalizes same-sex activity on people's mental health and well-being in Botswana? And I could say, yes, we can do that because we now have that data from Botswana. And then I can show you point by point how LGBTI people in Botswana have higher levels of depression compared to the general population, have higher levels of anxiety compared to the general population. And I can give you a quantitative assessment of how many times LGBT people in Botswana have been denied access to healthcare because of their sexual orientation or gender identity. And because we have those numbers, the lawyers can make a very strong argument to say this is the ways in which the law that criminalizes same-sex activity, the penal code, and those sections of the penal code impact the mental health and well-being specifically of LGBTI people. There's a big pot of magic ingredients, and that pot contains the fact that we had so much participation and decision-making from so many organizations we've worked with along this project. Usually often research is an academic having an idea and doing it. And the fact that we, from the very beginning, had organizations leading that process and leading the decision-making of what we were going to do and how we were going to do it is one big aspect of also why we're able to get so much data. I think the other magic ingredient is the real enthusiasm of everybody who worked on this across the 23 organizations and who've been really willing to put time in, to put their efforts in, and I think we've been able to see how important that project was and how important data is, and we've really used it to push for the project.
Yes, so I wanted to speak about the engaged process that this research has taken. Basically, the entire process has been working in partnership between us as academics with community-based organizations who are actually implementing and influencing the research and will ultimately be using the research, as well as our funder. And the fact that this process of engagement has happened from the very first day of developing what the research question would be all the way up until now when we're planning the dissemination is really amazing and powerful. It's the first time that I've been involved in a research process that uses this level of engagement. Well, I mean, it was based on the principles of the research that were drawn up from the beginning. But in terms of seeing how that has played out in the process, I think there's been many examples of how the changes happened and how it's been useful. One, for example, yesterday I was speaking with someone from one of the partner organizations, from one of the community-based organizations, and we were talking about disseminating the research, and he said to me, I kind of thought when we were doing the research, this would just be a report that was going to go on a shelf at the University of Cape Town somewhere. And I'm starting to realize that actually we can use it in so many ways. And, he was really starting to think, how can we use this data and how can it actually benefit us and our community? And that was really exciting to talk about. But since we've been talking about engagement, I think one incredibly important part has been communication. So having the opportunity to speak with partner organizations throughout the research process, we spend a lot of time emailing each other, WhatsApping each other, and the fact that everyone has been so open and excited about engaging on this research has really strengthened the process and strengthened the quality of the data.